Oh, very welcome. Next speaker, and he's Dr. De Chen. He is a PhD Oriental medicine and both acupuncture license in American, and also he is a founder with the motion acupuncture. And today he will give us a very big speech about his fund. He found the special technique about the motion acupuncture. So right now, give us a big palm for the Dr. Chen. So Dr. Chen, that's your time.
Okay. Thank you, Dr. for introduction to me. I'm happy to be here to meet a lot of TCM acupuncture friends in here. So today, let me share my new knowledge and the technique we call motion acupuncture therapy. It is a new acupuncture technique. So now let me share my screen and talk about what is motion acupuncture. It is special for soft tissue injury about the painful disease. Okay, let me share the screen.
Thank you, thank you. Let us waiting for Dr. Chen.
Hello, everybody. My name is Cheng Chen from New York. So today, let me talk about my new acupuncture therapy, a kind of new technique we call motion acupuncture. And today we do combine with the cases analysis of the talk about 4 innovations of motion acupuncture. We will talk about 5 parts of motion acupuncture included, like motion acupuncture point, motion acupuncture needles, motion acupuncture technique, and motion acupuncture retaining needles that we call dynamic retention needle, and also motion acupuncture mechanism. So around the 4 parts of motion acupuncture, about the 4 of 5 is innovations. So now let me show the detail. What is the motion acupuncture? Maybe some friends know, some people don't know it, but see this video and you will understand what is acupuncture. So this patient has trigger finger and the middle finger for 1 year. He did some treatment, acupuncture, injection, physical therapy, whatever, but doesn't work. We only did 1 treatment. We see the result.
Motion acupuncture for trigger finger 动筋针治疗弹响指。
So which finger?
Middle finger, you want me to hold it?
Yes, it's fine. The middle finger.
Yeah. Yes.
Okay.
Hey,
Difficult to move with the finger. It is locked.
1 year.
1 year.
I even got the cortisone shot. Didn't work.
Cortisone. How many cortisone?
1 time. The needle this long.
When you did it?
Last year, August, I think.
Last year or 1 year ago.
Yeah, a year ago.
And after the start, the infection will go better.
No.
No, but
It's worse. To me, I think it's worse.
But now you're completely wrong, huh?
Yeah.
Okay.
Even before.
That.
Well, I don't want to do it again because I don't want to lock it there.
Sure.
Yeah.
And you can feel well?
Yes.
Well.
Right here.
Okay.
Especially when I pop it. Yeah, when I pop it, it hurts so bad. And sometimes when I'm doing something, it just locked up. Yeah. Yeah.
How many treatments you did?
Oh, too many. At least 20.
Any acupuncture?
Yes, I did.
How many treatments?
At least 10. 10 to 12, maybe. One needle, but my sister-in-law told me about you, so I had to come.
Do exam to see where is the motion point. we put the needles according to the anatomy, certain muscles. We do special technique. That's a special technique. Like patient's movement with needles. So I put the 4 needles on the arm. You see, after certain exercise movement, you see, the pain less, movement better. No more lock.
Oh, much better. Yeah, definitely. Oh my God, I can't believe this.
You see, wonderful.
Oh, doctor, you're a miracle worker.
Oh, you know, we have different techniques, right?
Yes. Oh my God, I can't believe this.
Without surgery, you know,
I didn't want to do surgery.
you can't just doesn't move. You see, without needle, without surgery.
Oh my God, I didn't do this for a year. A whole year. Yeah.
Oh, see, we can, before treatment.
Yes. It's like,
I saw you. You see? Wow. You can come a little bit. You see? After, you know, couple of minutes the treatment, and then patient get much better. So that's the why you see we do the acupuncture without at the local on the finger. So we according to the theory, we found the motion target point. So the definition about motion acupuncture, it is refer the application motion acupuncture needles we call MA motion acupuncture. To use dynamic retaining the needles to treat diseases. This is during the treatment. The patient exercise special part of body must be movement and the instruction of the doctor. So that's the book about motion acupuncture therapy. I published in March 2020 about the Chinese version. So far, we don't have English version. Maybe next year, we try to have a new version in English. This is the article 21 articles published in the medical magazine journal, whatever the English and Chinese. Okay, this is the 2 English articles about motion acupuncture course, the class teaching promotion in around the world. You know, in United States, in China, Changchun University of TCM, Wenzhou College of Medicine, in Washington, D.C., Minnesota, Beijing, Shandong, Canada 5 years ago, and also we have Chicago, France, Turkey, Moscow, a lot of country. We have a lecture and a class for the local traditional Chinese medicine doctor and acupuncturist. So a lot of people love it. They think it is easy to learn and very effective to use. Since 2020, the big education of TCM website called Qi Huang website, they have our online class for 68 hours in total, including basic, foundation, and clinical 1 to 3. Also, they have a special class in the Qi Huang network. 2021 in US, from the Association of Traditional Chinese Medicine Society, they make a full season 4 parts of the motion acupuncture training class, total in 48 hours. And this is in Europe, UK, London started. And current we do in Germany, Europe, also 48 hours, including 4 parts of the class, each one 12. Also from the body, different part of the body, such as head, neck, shoulder, and the arm, and also waist, abdomen, and the lower back, lower leg, whatever. So, according to the part of the body, we set the class. This year, July 22 to 24, we will have in person the class in Guangzhou, China. And this we will have offline in Toronto, September 9 and 10 in person. Hopefully, if you love it, you can join this class. We have the code, you can scan whatever in Toronto this year, September 9 and 10, 2 days. We see the next one, we see the video about motion acupuncture for the neck pain. This lady is neck pain and stiffness for 2 weeks. He cannot move her head and neck easy. So he can have the pain and come to our treatment. You see, we did one treatment, see what happened.
Motion acupuncture for neck pain stiffness. 动筋针治疗颈痛僵硬。
Where is the most of it? There. Particularly here. Okay. How long from now? For how long? 2 weeks. 2 weeks. Any injury you remember? We had a prior treatment, but it was not time ago. Oh, but 2 weeks ago you don't have that. 2 weeks ago nothing happened. No, 2 weeks nothing. From sleeping, maybe you can talk and then you feel. No, I just woke up and it was. Okay. So now you do flexing. Okay. And extension. You do that. Okay. 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 Can verify? Okay. Feel okay, right? Okay. A little bit. Left. See? Difficult. Before treatment, you see difficult to move to left side. And we do exam. Also here. Yeah, to find the trigger point around the scalene. Here. ICM muscles, all from the motion needle part. The treatment by the special needles, motion needles. See, special technique. You see this pulling is special. Stagnation needles and then pulling. Okay. Okay. You heard the sound? Quickly to release tissues tight and not. You see, this is around different motion point. Okay. After needling, we do movement, but much better already. Extension is free. Okay. So now do this one. You see, it's normal arm, right? 1, 2, fast, stretch, go. And you see, you can move free. You feel by yourself naturally. You move what you want. Try which angle if you feel difficult or pain anywhere. No, it's much better. Much better. Really, right? You can do any direction, right? No, much better. Yeah, only one treatment. Good. You couldn't drive. You know, you cannot drive.
Yes.
No, 2 weeks, no?
No, 2 weeks I moved the entire body.
Yeah, yeah.
Dangerous.
But now you see?
No, much better, yeah.
Okay. Okay. So when we put needles, anytime, doesn't matter you use what kind of needle, but you have to choose the point. The point is the first things. You have to know where to put the needles. And second, what kind of acupuncture tools you use it. You can use favorite needles or a P needle, whatever. So we use motion acupuncture needle. The method, the puncture, how to do it, different method, you use different needles. And after needling, what you like patient to do, retaining the needles, is movement or without movement, or like patient do not move, mostly like that. But we change it, we let patient move. So when we do the choose the point, is we call motion point. Needles, we use motion needles. About the method, we use motion technique. About retaining needles, we use dynamic needle retention. So first, let me talk about the point. The point is the most important. It is the first things we have to choose the treatment point. This point will be movement. According to 3 steps and 1 procedure, we can find the point. First, let patients complain where the most pain, use 1 finger to show. And second, let patient do exercise to see range of motion. And third one, we know which muscles may be involved the pain and limitation of movement. So we just palpate by finger to find the motion point. This case is around the scaling point, the time we don't have to solve. The 3 steps, the first, patient's chief complaint, and second, the range of motion we test, and third one, we do palpation by physician. Second thing is the needles. The needles is specially, this patent needles, we just get a patent 2020. It is 3 sides of the needles. The needles, the gauze, you see 0.3 millimeter is very thin, like a faithful needle. 3 sides longer, 40 millimeter, 50 millimeter, and 75 millimeter. So 3 sides needles can use anywhere of the body. It is enough. We see the structure of the needles. This needle's handle and tip is the same like faithful needle. Only the body is different. You see the body with the spirit and with age is different. See the picture. You see it is the left side is real motion needles. The right side is and skull piece. Okay. You see the needles, the body is not around with the polygon and the spiral. It is like the nail and the skull. You see the different things. The nail easy to remove, but the narrow is the nail easy to remove, but the skull is difficult. Okay. This is the microscope. We see the needle body is like that. So different from faithful needle is around. Okay, it is very interesting. So about special needles, we use a special technique. We have a simple technique, multiple technique, and special technique. In the book, I already talk number 1, number 2, number 3. The special, we have to let you know it. This special technique, first one is stagnation needles with lifting. That means you 1 clock side or counterclockwise to rotating the needles, and until stagnation, you can lifting. And the direction can be horizontal, also can be perpendicularly. So the lifting degree we have a limitation the lifting and also extreme lifting. We see what it means limitation lifting. You see, we see the video, I can understand. You see horizontally, we put a 3-inch 75mm needle, motion needle, one side rotating, hold the needles and lifting. You see, no, the patient do not feel pain. Sometimes ask me pain, and this one we see it is perpendicularly. We put the needles, also lifting, thrusting, but needles are still inside muscles, no get out. That means the needles are stagnated in the soft tissues. It is very interesting. This one is for internal organs disease. This patient has IBS. After this treatment, he feels very comfortable. Another kind of stagnation needle weight lifting is we call extreme lifting. You see this video. Yeah, you heard the sound? Yeah, when you rotate needles, is sticking the needles quickly, strongly to pulling needles until you heard a sound. Okay. And the second kind of special we call through lifting. You see the needles through the soft tissue, through the skin. We see this one. You see this is tendons able. We use 3 needles through at the local, and then do exercise. One treatment, this patient got much change, much better. This patient play violin, so he has a lot of arm pain. You see, this is through, needle through, and then we do lifting, thrusting. Lifting. Okay. We pass this one. Number 4 is dynamic returning the needles. We put the needles also let patients do the movement. The movement including patient volunteer to do it. All other one is purpose to do. We help patients to do. And another one is loaded exercise. So we against the patient's action to do it. There are 3 steps of motion acupuncture. First, we have to find the point. Second, we know how to put the needle. And third one, how to do exercise. So from the target treatment point is basic. The puncture of the needle, it is the key, is more important. And otherwise, the center is around the movement. Without the movement, sometimes we cannot get the same result. What is the indication of motion acupuncture? We can say mostly for pain, for any kind of pain, from head to foot, headache, neck pain, shoulder pain, waist, low back pain, sciatic disc herniation, whatever, blah, blah, blah. Also for some internal disease like tinnitus, dizziness, lose weight, indigestion, IBS, even for female issues, the gynecological infertility, dysmenorrhea, whatever. What is the mechanism about motion acupuncture? We see that's a picture. That's a picture. We see the bone is a misposition, the bone, and the muscles, 2 muscles between is sticky. By the injury, is connected each other, get hard. So after motion acupuncture treatment, put the needles between the muscles, and then by the movement, you see the 2 muscles, the right side picture is, separate. There was a space between the 2 needles. and then the muscles power, the muscles will tense, will be released. So you see the bone, the joints come back. Okay. So now we see one more video around the past fasciitis about the foot pain. Some people said it's difficult treatment for the foot pain, heel pain, whatever. We see.
What kind of doing walking, standing, doing something?
Generally, it's when I standing and walking. I'm
Okay.
that's
The left side, right? When you go like that, it's pain.
yeah. There's no pain here.
Well,
On the back.
so that means that when walking, it's a first, right?
Yeah.
You try to walk now.
Yeah.
It's right?
Oh yeah. Oh yeah.
See, we do the needles. Also, certain needles we didn't put at local. Local needles, hand and feet, usually very painful. But this on the leg, you see the trigger finger, we do the arm, and then do exercise. Exercise is important. Can lose all the muscles, release the pain.
No. No, they are. You know? Yeah. Okay. Before when you do like that, you can start right, then start to do like that.
What?
Correct.
It's a bad.
Much better, right?
And before I couldn't walk, I was moving my now I
Now you are walking like no one.
like my when I come here, I was like that.
Yeah. So go and come.
Oh,
Very good, right?
you saved my life.
Okay, you see, all of the treatment usually, usually at the same time, we get the result. We have one more we see, maybe a couple minutes we have. See this one? This is a neck pain, cannot squat.
You don't remember yeah. Okay, can you follow me? What is the best you can do? You okay? Only that, you cannot do more. Do your best and then stop it. Okay. Okay. Yeah. Okay. Going down. Going down. Okay. Okay. That's it. No, you can keep it. Yeah. Okay. So that's the best part. Yeah.
That's before treatment, cannot squat. Knee pain.
No, is the pain hard? Okay. How about here? Yeah, yeah.
You see, special, all use the motion acupuncture needles, the different from needle. Use special technique, stagnation and lifting, thrusting, lifting. Okay. See, exercise with needles. See, come on the floor to walking also with needles. The needle is still there. You see, she can squat during the treatment. You see, all the way down.
Wow. Wow.
You see? Yeah, after treatment, we see. Needle remove. You see? Before, during, and after. Each one different. Okay. So this today we briefly let you know about what is the motion acupuncture Mostly we do some video case analysis because the time is very limitation. Doctor will give me 30 minutes, so mostly is done. If you're interested in this topic, you can come to our YouTube channel. We call Dr. De Chengchen. You search from Google, from YouTube, you can find around 500 video there, a lot of, okay? But some are English, some are Chinese. Also, with summary about today, today we do the full innovation of motion acupuncture. It is about a motion acupuncture point and the motion acupuncture needles and motion acupuncture technique and also dynamic retaining needle. That's the full item is new. It's different from a traditional Chinese acupuncture. Okay. If you're interested, you have more questions, you can scan this is my WeChat, this is my email. We can discuss it in future offline. So this is our office in New York, Manhattan, and Long Island. So the address, email, this is our website, bestacupunctureclinic.com. You can see, you can contact us to discuss about this topic. If you're interested about the online class, also you can contact us. Thank you, everybody.
欢迎大家继续来到第7届世界整合医学大会。下面呢，我们又有一位这个讲员登场。这位讲员呢是一位美国人，他是叫 Curry Brown， 美国科罗拉多州的注册针灸师，中医学硕士，美国新奥尔良人，最初追求西医，但渴望一种整体方法，对自然疗法产生兴趣。他通过导师发现了中医，从而开始在丹佛学习针灸和中药。这段变革性的旅程确认了他的使命。他从患者健康的改善中找到了喜悦，通过整体方法解决了自己的慢性问题。Curry 渴望分享他的治疗知识，目前在 Colorado 中医药大学攻读针灸与中医学博士学位，专注于古典医学。他一直致力于作为一名疗愈和医者的目标。他今天演讲的题目是以证据为基础的中医治疗癌症化疗的副作用。好 ，So next, please, Dr. Liu, read the English one.
Yeah, thank you, Dr. Fu. Let me introduce Mr. Corey Brown, a licensed acupuncturist, a diploma of acupuncture, and a Master of Science in TCM, a New Orleans native. He's a native from New Orleans and initially purchased Western medicine, but yearned to the holistic approach. Entangled by the natural remedy, he discovered traditional Chinese medicine through the mentor, leading him to study acupuncture and herbal medicine in Denver. The transformative journey confirmed his calling, finding the joy in his patient, improved health, relief of his own chronic issue through the holistic method. Coy is eager to share his healing knowledge, currently purchasing a doctorate degree of acupuncture and oriental medicine, focused on the classic Chinese medicine. He's remain dedicated to his purpose as a healer. Let's welcome Mr. Coy Brown.
Very happy he very interesting for the integrative medicine. So let us put palm together. Welcome the Carrie Brown.
All right. Good morning, good afternoon, good evening, depending on where you're chiming in from today. My name is Corey Brown, and I am a licensed acupuncturist and herbalist in Denver, Colorado. I am also a current doctoral student, finishing off the DAOM program at Colorado Chinese Medicine University. And I am excited to present to you today a presentation about evidence-informed treatments of chemotherapy side effects in Chinese medicine. And, I chose this field because I work with a lot of cancer patients. And, a lot of cancer patients are always looking for ways to offset, the side effects, the debilitating side effects of chemotherapy. And so I feel like our field can really help patients as they go through that whole healing journey. So I'll begin with some of the basic knowledge, and then go into some research, and also present a few cases as well. So we'll jump right in. All right, so I'll be starting off with the psychosocial model, talking about the biological factors. So beginning with the chemotherapy side effects and everything. So chemotherapy targets cancer cells, but also affects healthy cells, leading to side effects. And some common side effects are nausea, vomiting, fatigue, hair loss, immunosuppression, anemia, and other side effects depending on the patient. There's also genetic factors. So patients' genetics can influence drug tolerances and susceptibility to those side effects. And then moving right along into psychological factors. So emotional well-being. So chemotherapy can lead to anxiety, depression, fear, and uncertainty about the future. And there's also some coping mechanisms. So patients may have different coping strategies and adaptability. And then we talk about quality of life. Psychological well-being can impact a patient's perception of their quality of life. Then social factors. So having a strong support system from family and friends and healthcare professionals can make a significant difference. And access to healthcare, financial resources, and insurance can affect treatment options. And then beliefs, norms, and values influence treatment decisions and complementary therapies as well. Then we talk about how chemotherapy side effects are addressed. So there's biological interventions such as medication, dietary changes, and symptom management. There's psychological support in the form of emotional support, counseling, and resources to address psychological impact. And then there's also social support, such as access to support groups, education, and practical assistance. Then the exciting information is the TCM view of chemotherapy on side effects. So we talk about harmonizing qi in blood, which chemotherapy disrupts the flow of qi in blood, leading to fatigueness, weakness, and anemia. Then we talk about the yin and yang balance. An imbalance between excess yang and deficient yin results in symptoms such as hot flashes, dry mouth, and inflammation. Also, organ systems that's in focus. So TCM associates specific organs with symptoms, for instance, emotional stress affecting the liver. And as we know, that can vary depending on the patient. So different symptoms, different organs can be at play depending on the patient. All right, and then talking about the nurturing aspect. So as far as the treatments, acupuncture can help restore the chi flow, alleviating symptoms like nausea, pain, fatigue, and emotional distress. Herbal medicine, so personalized herbal formulations to address symptoms such as nausea, diarrhea, and immune support. And dietary harmony, balancing yin and yang through a thoughtfully selected diet using cooling and warming foods. And I'm a big proponent of the dietary aspect because some patients just either can't handle herbal medicine or they're taking some medication currently that just don't mix well with the herbs. And so diet is an easy thing to kind of help recommend to patients that they can be doing every day to help themselves. And it also gives them a way to be part of the healing process as well. All right, and mind and body practices, something else that I recommend a lot in clinic. So qigong and tai chi, which offer gentle, holistic exercises that improve energy, mental clarity, and overall well-being. Because as we know, there's a lot of mental overthinking and stress, and just a lot of thought that's going on during this process for patients that are undergoing chemo and that have cancer. And so qigong and tai chi not only helps that mental aspect, calming aspect of the mental aspect, but also to help continue the flow of energy and healing throughout the body. Then moxibustion, utilizing moxa for warmth and chi promotion. It addresses cold-related symptoms. And then mindful well-being, which also kind of goes into the qigong and tai chi realm as well, incorporating meditation, mindfulness, and relaxation techniques to mitigate stress and support emotional health. And integrating TCM with modern medicine. And I feel like the majority of the time, this is what is happening, right? The patient is already going to their Western oncologist, getting treatment, and then they're coming to you to kind of help support that care, which is very important. So when we talk about collaborative care, this talks about engaging TCM practitioners while working closely with the oncologist to ensure a synergistic approach. So working together. Individualized treatment. TCM's patient-centered focus allows for tailored care to address specific needs and concerns. Complementary synergy. TCM serves as a powerful complementary therapy, enhancing the effectiveness and well-being of cancer patients during chemotherapy. All right, and so we're gonna move right along into some studies. I have like 4 studies. I'm not gonna go too much into everything that's on the slide, but just kind of give an overview of what each study was providing. So this talks about traditional Chinese medicine, diet, paratherapy for alleviating toxicity in chemotherapy and radiotherapy in cancer patients. And this was a meta-analysis. So the key findings was enhanced symptom management, hemoglobin improvement, enhanced quality of life, and also contributing to weight gain. So TCM diet therapy outperformed ordinary diets by significantly reducing chemotherapy side effects, including leukopenia, nausea, and vomiting. Notable increases in hemoglobin levels was observed in patients following the TCM diet, indicating a positive impact on blood health, enhanced quality of life, and then weight gain. TCM diet contributes to weight gain, potentially mitigating the weight loss common in cancer patients. And there was some certain limitations and need for future research. So for this particular study, the limitations were predominantly it was basically because this particular study predominantly involved the Chinese study population and certain methodological issues in the original studies they felt like may affect the outcome. So just needs for more variety of research in a variety of populations to kind of give a well-rounded view of everything. But overall, the results were positive for this case. All righty, and so this is, so the last one was talking about TCM diet. This is a particular research that supports Chinese herbal medicine for reducing chemotherapy associated side effects in breast cancer patients. This is a systematic review and meta-analysis. So as we know, breast cancer treatment typically involves a combination of approaches, including surgery, chemotherapy, radiation therapy, hormonal therapy, targeted therapy, and immunotherapy. Each of these methods are chosen based on the stage characteristics of the cancer. Chemotherapy is widely employed in treating both early stage, invasive, and advanced stage breast cancer, and it is sometimes used as a neoadjunctive therapy to reduce the size of tumors before surgery. Chemotherapy plays a crucial role in destroying cancer cells and improving patient outcomes. As far as the side effects, despite its effectiveness, chemotherapy often leads to adverse effects, which can significantly impact the patient's quality of life. Common side effects include nausea, vomiting, diarrhea, constipation, alopecia, hair loss, myelosuppression, and impaired immune function. The severity and occurrence of these side effects can vary widely based on factors such as the chemotherapy regimen used, the dosage, the duration of treatment, and the patient's overall health. The variability underscores the importance of developing strategies to manage and alleviate chemotherapy-induced side effects. Then, as far as introduction to Western medicine has sought to address these side effects with drugs like dexamethasone, 5-HT3 receptor antagonist, glutathione, magnesium sulfate, and calcium gluconate. However, these approaches may not fully meet the patient's needs, leading to search for additional adjuvant treatments. All right, and so talking about the efficacy of Chinese medicine in alleviating the side effects, Chinese herbal medicine has gained clinical acceptance as a valuable approach to mitigate chemotherapy side effects in breast cancer patients. The use of Chinese medicine often complements conventional therapies and offers unique benefits. Existing systematic reviews and meta-analysis have explored the impact of Chinese medicine when combined with conventional treatments, including surgery, chemotherapy, or endocrine therapy for breast cancer. These studies have primarily examined tumor response, quality of life, and reduction of hot flashes. But there is a need for comprehensive study. Some earlier reviews have provided inconclusive findings due to limitations in available data. There was an opportunity to conduct a more comprehensive meta-analysis by collecting as many relevant studies as possible and focusing specifically on evaluating the effects of Chinese medicine in managing chemotherapy-induced side effects. This study finding was that the meta-analysis outcomes demonstrated that patients receiving different Chinese medicine treatments experienced significant improvements in side effects such as chemotherapy-induced nausea and vomiting, diarrhea, alopecia, and myelosuppression. And some additional side effects that they talked about, they may experience are like hot flashes, kidney and liver injury, and cardiotoxicity. And then there was some focus on gastrointestinal side effects. And then they brought in some utilizing particular herbal formulas for the treatment of breast cancer. And so this particular formula, Yiqi GNP Hilway, therapy alleviated the occurrence rate of severe constipation, even though the difference wasn't statistically significant. And then looking at the alopecia, which we know chemotherapy has one of the major side effects is alopecia in certain patients. This meta-analysis included studies examining the effects of Xiao Yaping and Fuzhong Qingdu on reducing alopecia caused by chemotherapy in breast cancer patients as well. All right, so that was one particular study on Chinese herbal medicine focusing on breast cancer. This is also a Chinese herbal medicine study focused on the myelosuppression induced by chemotherapy or radiotherapy. This is also a systematic review of randomized controlled trials. So when we look at the Chinese herbal medicine in cancer treatment, this particular study involved 646 articles that were retrieved following a comprehensive search strategy. The demographics were 818 subjects with various types of cancer, and the focus of this study was to assess the effects of Chinese medicine combined with chemotherapy, radiotherapy on various blood parameters in cancer patients. The random controlled trial involved patients undergoing chemotherapy, radiotherapy in combination with Chinese medicine or without Chinese medicine. Different blood parameters were examined, such as white blood cell count, red blood cell count, hemoglobin, and platelets. Chinese medicine significantly prevented white blood cell damage by chemotherapy and radiotherapy, with relevant statistics and figures to support this finding. In the conclusion of this particular study, Chinese medicine has a significant protective effect on white blood cells during chemotherapy and radiotherapy in cancer patients. There is a need for further rigorous, large-scale, random controlled trials to explore Chinese medicine potential benefits in preventing other blood-related side effects. So that was another one kind of using more of previous knowledge to compile to kind of see where those gaps were and where further research was needed, but it also showed positive, promising results for Chinese herbal medicine in our field. And this particular research was based off acupuncture. So one about diet, two about Chinese herbal medicine. This talks about acupuncture for the prevention of chemotherapy-induced nausea and vomiting in cancer patients, a systemic review and meta-analysis. So chemotherapy-induced nausea and vomiting is a common side effect during cancer treatment. There is a significant desire in finding effective interventions to alleviate chemotherapy-induced nausea and vomiting symptoms and improve the quality of life of cancer patients. This systematic review focuses on the role of acupuncture as an intervention for chemo-induced nausea and vomiting. The key findings were that acupuncture, in addition to usual care, showed a notable positive effect on controlling chemotherapy-induced acute vomiting and delayed vomiting. This means that when patients received acupuncture alongside their standard care, they were more likely to experience relief from vomiting triggered by chemotherapy both immediately and with a delay. However, the results did not demonstrate a significant effect of acupuncture on chemotherapy-induced acute nausea and delayed nausea. While it was effective in controlling vomiting, it did not appear to be as effective in reducing feelings of nausea following chemotherapy. In comparison with sham acupuncture, the results did not show any effectiveness for acupuncture in the review outcomes. This suggests that the benefits observed may not be due to specific acupuncture treatment, but rather other contextual factors. It's important to note that certainty of evidence was generally low or very low, indicating that more robust research is needed to draw definitive conclusions. And some of the recommendations, because I'm not going to really go through too much of the particular study content, that I have listed here, but just this particular study was to show that we do need more research in the field, even though that acupuncture shows promising results. So as far as recommendations, efficiently conducted meta-analysis would greatly benefit from an agreed core outcome set for chemo-induced nausea and vomiting, reducing research waste, and improving data interpretation. Primary studies should provide more information on the effects of acupuncture in specific clinical scenarios such as chemo-naive patients, those with a history of poorly controlled chemo-induced nausea and vomiting, or those experiencing chemo-induced nausea and vomiting despite appropriate use of antiemetics. Researchers should consider collecting contextual information such as the patient-practitioner relationship and patient expectations to better understand the nonspecific effect of acupuncture. It is essential to investigate the moderating effects of acupuncture based on emetic risk of chemotherapy, the effectiveness of antiemetics, and the use of rescue medication. With no significant effects of predefined moderators were identified in this review, they remain important predictions and should be explored in future research. And so basically, this just kind of shows it really is has been difficult for them to do studies on acupuncture in general because of the inability to do blind treatments, like the inability to blind treatments, I should say, blind treatment providers, which can introduce bias. So definitely anybody out there that's interested in contributing to more evidence-based acupuncture treatments and chemotherapy side effects, it is definitely needed. And so now I'm going to talk about a few cases of my own patients that I've worked with that have had cancer and that have come in for treatment for the side effects. So this particular case involves a female that's age 63. This was done last year in August. She wanted support for pancreatic cancer, got diagnosed 2 years ago. She received some chemo and had surgery to remove the tumor back in August 2021. She found out recently that the cancer returned in the same spot and some nodules had spread to the lungs and stomach as well. Chemo wipes her out for 3 days with nausea, vomiting, and diarrhea. She has knee pain on the right knee, also has stomach pain on the left side of the abdomen, slightly above the navel. She also has pain in the lower abdomen around Dufour point when laying on her back for too long. She would like to support her body before receiving chemotherapy on the next day. So after, doing her pulses, because predominantly using this intake information in her pulses, this is how I came up with my diagnosis. The pulse diagnosis was Mingmen fire decline. And this basically, I study classical Chinese medicine currently in my doctoral program. And so this was utilizing a technique of finding what was most significant. So finding the most significant pulse out of all of the pulses and going after that to kind of help treat that and help the body to overall balance itself. And so in this patient, the Mingmen fire was deficient, so the goal was to tonify amendment fire. These are the points I used. I used a few T's, which is also it's based off the Tang Ye method of also treating the body from that specific significant aspect that needs to be treated. So with this, the results, the Yuan Lo technique was applied to tonify Mingmen fire. Some other points were added, such as Ren 4 to supplement Mingmen fire more, and Stomach 36 to assist with tonifying qi and reducing nausea, vomiting, and diarrhea. The fire and water tea were combined and prescribed to continue to tonify Mingmen fire. When the patient returned for her next appointment, she felt like treatment helped because she wasn't nauseous going into chemotherapy like she normally is. She did throw up after eating after the chemotherapy session, but it didn't last as long as it usually does. Case 2, also working with a female that was 53 years old. This was back August 16th, 2022, so also last year. She came in for immune support and support for chemotherapy side effects. She has a Western diagnosis of cervical cancer, stage 4. She was currently experiencing lower back pain and quad pain on the sides. She has also been feeling very fatigued. She also had been having pain below the left scapula. When she came in, her energy was a 1 out of 10. Body temp, she runs hot sometimes, according to her husband. She experiences some high-pitched tinnitus several times a week. Tongue had cracks, red especially on the tip, sticky coat. So the left side of the pulses were thin and thready, and the right side was also slightly thin and thready. The diagnosis was qi and blood deficiency with underlying liver yin deficiency. So the treatment principle was to tonify qi and blood. So I applied moxibustion when the patient first came in because she talked about feeling kind of faint, even though she had eaten. So I did that first to help build up qi that could be utilized for the treatment. And then I used points lung 9, stomach 36, and Ren 6. So not too many points. Attempted to do Zhuanzhong on Ren 15, which is a technique where there's 2 needles and 1 point at an angle to help to kind of regulate the middle jiao and balance the wood and earth elements. But the patient was very sensitive and felt pain, so I did not do that point. But I also sent her home with ear seeds in the shoulder and scapular area to assist with the pain. After the treatment, the patient felt like her energy went from 1 out of 10 to 7 out of 10, and she was more clear-headed. When the patient returned for her next appointment 2 days later, she reported that she had more energy than she did when she came in for her previous treatment. She still experienced some fatigue. Once she starts to walk, she'll feel like she needs to sit down again. She reported that the pain beneath the left scapula was a little bit better. She feels like the ear seeds have really been helping with the scapular pain by pressing them. And that's something else I like because I'm all about empowering the patient to be a part of their treatment process. So giving them the ear seeds, once again, that gives them something to do, but they also have that available to them consistently on a consistent basis to help them with their discomfort. And the last case, this is more recent, a male, 45 years old. This was last month, or 2 months ago, September. The patient wants continued support for neuropathy in hands and feet due to chemotherapy. The patient is recovering from stage 4 cancer, colorectal cancer. He has undergone the most aggressive chemo treatment that his Western physicians can give him. They have surgically removed some of the big cancer that could be removed, but he still has some of the cancer present in his lungs and his abdomen and intestines. His most recent PET scan has shown that the cancer is growing. He was told the past Monday that he couldn't start the stronger chemotherapy that was recommended for him because his white blood cell count was too low. Today, his energy was very low, 2 out of 10, and his digestion has been upset the last few days, manifesting with nausea and bloating. He thinks the digestion is messed up because of an aloe decoction that he had been drinking, that his partner had been making for him. His bowels were soft and sticky, tongue slightly dusky coat in the center, crack in the center, pale patches on the side and tip. Left side pulses, left sum was the most deficient, but pulses were overall deep and weak. On the right side, pulses were overall weak and deep. Diagnosis, once again, I included 2 aspects here. So in the system of the classical Chinese medicine I study, and also on the right side, TCM. So on the left, fire deficiency, meaning his left sum was the most deficient. So I focused primarily on tonifying fire. But then on the TCM side, Qi and blood deficiency. And then so the treatment principle was to tonify fire, tonify Qi and blood. So those were the points I used. I used moxa and also acupuncture together. Dietary, I acknowledged him to reduce aloe, cold foods, and raw veggies from the diet, increase cooked foods, cooked vegetables, and warming foods. And I recommended ginger tea for the nausea. So this is a little bit more about what I did. So I applied moxibustion first before I even started the treatment to help tonify the chi because his energy was so low. So to build up a little chi first to see if there was chi to work with. After the moxibustion, I applied the Tangye method to tonify fire. After the treatment, his pulses felt much stronger and his left Sun pulse rose up in balance. The pulse reported that he felt like his energy was much higher after the treatment. Upon returning for the next treatment, he reported that he noticed after trying ginger for a few days, he went from having loose stools and having bowel movements multiple times a day, which he was having bowel movements, he was losing count, to a few times a day, and his stool was now much more solid. So those are my references. And so basically, that was my experience with working with cancer patients. I do work with a lot of cancer patients, and it shows very promising results, kind of help really treat the body from the root. Because as we know, one thing that we really stand out in is giving a more personalized, individualized approach to patients' treatment versus treating them all the same with the same protocol. So that's very important to help really make sure the chi in the body is balanced at the root so the body can really fight off what's happening in the body. So if you guys have any other questions on anything I spoke about, any techniques that I may have not went into more detail on, feel free to reach out to me. Here's my contact number, email address, and website as well. Feel free to reach out to me, and I'll be happy to talk with you in more detail. So I hope everyone enjoyed what I had to present today. Hope some of you may be moved to contribute more to this field of study. And hopefully I may meet you all virtually or in person in the future. Have a great day.
The evidence-informed treatment for chemotherapy and their side effect with the Chinese medicine is real deep research about the evidence-based medicine and in acupuncture and herbal medicine treating, especially for the chemotherapy, the side effect. In this presentation is a wonderful example for the new generation who studied in the native in the United States and get great skill to harmonize the patient chi and restore the yin and the yang, the balance for restored energy for the people who have a side effect of a chemotherapy. This plus the Qigong and the Tai Chi and the herbal medicine and the dietary Chinese medicine are such a wonderful presentation. And thank you, Mr. Brown, for this presentation. And furthermore, and in the social factor, and Mr. Brown have a point out is the social well-being and the psychological well-being in the people with the chemotherapy. That's a real part for the Chinese holistic and the integrative the medicine to be a heal, to heal the people, to heal the whole people who suffering the chemotherapy and with their side effect. Again, thank you, Mr. Brown, for such a wonderful presentation. Thank you very much.
I will like you speak a little bit Chinese for the Chinese people. They can understanding a little bit.
谢谢了，谢谢这个布朗先生的精彩的演讲。他的今天的演讲题目呢是以循证为基础的中医化疗，治疗中医化疗副作用。他特别强调了大量的研究报告的基础上的中医中药、针灸、气功、太极拳对于化疗以后副作用的一个广泛的在北美，特别是美国的各个大医院的一些研究的报告，是非常全面的一个研究的一个总结，是一个非常整体的整合性的一个循证研究，以证据为基础的中医的一个治疗 癌症化疗以后副作用的一个研究报告，非常的一个精彩和深入，非常感谢布朗先生这个精彩的演讲，谢谢他，希望他继续的在中医的行业里，特别是见证了一个在美国培训的一个New Orleans native 的 American and can be a great acupuncturist and can be a great herbologist, can be a great Chinese medical doctor. Thank you very much. 谢谢了哈。
Yeah, we will very happy the Brown join us a big family for integrative medicine. So thank you, Brown. So and right now we will put the palm together. Welcome the next one speaker, and I will share his PPT.
真不容易，
下面呢，我们就会
是一个 native 的。
下面我们
您说
就邀请下一位这个讲员。那么我们很高兴，刚才 Brown 啊，他是成为了我们的议员啊，从一个美国的一个喜欢自然医学的医生变成了一个针灸师，这也是很不容易的。下面呢，我们要介绍的这一位呢，也是一位美国人，
是一位加拿大人。
他是一位加拿大人。好，他的名字呢叫Major Self Dividend。他是一位教育工作者、创意的音乐人、康复治疗从业者，目前正在乔治亚学院学习针灸。在长期的护理和社区诊所工作期间，他对自然和整体疗愈的热情逐渐增长，致力于支持个体过上幸福健康的生活，专注于身体、情感和社交健康的康复和维修。Maggie 自10岁起就一直参与音乐剧的演唱和表演，他花了许多年的时间进行吉他的演奏和歌曲创作的演出和教学。创作音乐一直是 Maggie 创造力和情感的出口，通过各种吉他弹奏的方式、和弦进行的歌词的选择， Maggie 能够唤起自己和听众内心的情感。他总是热衷与他人分享他的音乐。他今天要介绍的题目是中医的5行音乐疗法中的创意与情感的疏导。So please, Dr. Professor Liu, read the English one.
Oh, thank you, Dr. Fu. Maggie is a wonderful musician. Is a wonderful musician and an educator, the creative music writer. Pardon my Chinese translation. He's a real creative music writer and a recreational therapist practitioner, and currently in the journey of study acupuncture at the Georgian College in Canada. Her passion of the natural and holistic healing, supporting individuals to live their happiness and the healthiest life, grown as she worked in the long-term care facility and the community clinic. The focus on the recovery and the maintain of a physical, emotional, and social well-being. Maggie has been seen and performance in the music theater since she's the age of 10. She spent many years performing and teaching guitar and songwriting. Writing music has always served as a creative and emotional outlet for Maggie. Through the various guitar strumming, the pattern, the choreography, and lyric choice, the Maggie is able to evoke the emotion with himself and her listener. She's always enthusiastic about sharing the music with others. And his presentation today is wonderful, the music, and we're going to enjoy his music therapy, enjoy his own music. He's going to play 今天再说几句中文。他为特别这次大会呢，创作了5首中医原创的中医五行音乐，用现代的北美的乡村和 pop music 来作为音乐疗法的创意和情感的一个疏导，非常有价值、有意义的一个音乐治疗的一个创意，把中医和音乐治疗，特别是中医五行与现代北美流行音乐结合在一起。它是在北美，包括美国和加拿大，是在音乐治疗里用中医音乐治疗的一个先驱，一个发明者，一个创意者，一个音乐家。Let's welcome Maggie for his creative and emotional outlet in Chinese five-element music therapy.
让我们热烈掌声欢迎我们这个喜欢吉他的，又喜欢中国传统五行创作的音乐的 Maggie。
Hi, my name is Maggie Self-Devoutian. Thanks for having me at the 7th World Conference on Integrative Medicine. I'm excited to be here sharing my research and studies just surrounding the creative and emotional outlet in traditional Chinese medicine's 5 elements music therapy. Just a little bit about myself. I'm currently studying in the Georgian College program of acupuncture. I am an educator, creative music writer, recreation therapist, and my passion is for natural and holistic healing and supporting individuals to live their happiest and healthiest lives. And I've had some experience working in long-term care and different community clinics, focusing with individuals on their recovery and maintenance of their physical, emotional, and social well-being. And my background's also in music, so I've spent many years performing in musical theater since the age of 10. I've also done some guitar teaching and songwriting. And for me, songwriting has always served as a creative and emotional outlet. And through various guitar strummings and patterns, as well as chord progressions and different lyric choices, I've been able to evoke emotions within myself and also listeners of my music. So I'm excited to share my music with you today. And in connecting my music to traditional Chinese medicine's 5 elements music therapy, really connecting the music as a creative and emotional outlet. And so it's been remarkable, the studies and research that I have found on the correlation between different types of music and each emotion within the traditional Chinese medicine's 5 elements. And for me, since my music writing is deeply rooted in emotion, a significant portion of this presentation will be dedicated to exploring how the 5 emotions can be elicited, regulated, and harmonized within traditional Chinese medicine. And to highlight the aim of this presentation will be the role of each emotional balance in maintaining overall homeostasis within the body and thereby promoting health. So we'll start with a bit of a history on Qi, Qigong, and the 5 elements theory, and that will lead us to understanding the creation of the 5 elements music therapy. I'll also explore a little bit about how some acupuncture practitioners are using the 5 elements music therapy in their practice today. I will then share 5 original songs that I wrote with my partner Panthea, which each song correlates with each of the 5 elements, musical notes, and emotions. And so each song has the potential to evoke emotion, which may allow the singer or the listener to better process an emotion they may be experiencing or bring out an emotion that they may be lacking, in order to bring the body back to harmony, which is always the goal of traditional Chinese medicine's 5 elements music therapy. So just to start us off here with a quote, the 5 elements music therapy can regulate the function of internal organs, balance yin and yang, maintain the dynamic stability of qi and blood movement so as to keep healthy. And here I've just created a Venn diagram just to show the correlation and overlap of qi, qigong meditation, and the 5 elements theory, that when all put together kind of we can better understand the 5 elements music therapy. And for me, the idea really started with how songs can be meditative through different forms of breathing and making sure that the mind is in tune and to understand and process different emotions. And we'll get into a bit of the history of Qigong and Qi. So Qi, we know, is the vital energy, the dynamic force. Gong meaning the skill of cultivating, regulating, harnessing Qi for self-preservation, health, healing, and longevity. And so the goal of Qigong is to harmonize the breath, harmonize posture and body movements, and also harmonize the mind. And how is Qigong practiced? It's slow, intentional movements, focused, modulated breathing, consciously relaxing, and practicing with intention. So bringing that into the music therapy, again, for me, there's some overlap with songwriting and the actual process of singing songs as well. And continuing with some of the benefits of Qigong meditation, it's been found to reduce depressive, physical, mental fatigue syndromes. There's anti-aging effects. It establishes the balance between the body, mind, and spirit, and also can help achieve optimal health, well-being, and spiritual cultivation. The 5 elements music therapy, now if we get into how that came to be, really in China dates back to the Neolithic age, the New Stone Age, and it was discovered through music therapy being added to the traditional Chinese medicine, and really putting those two theories and therapies together created the 5 elements music therapy. It was thought that the 5 music scales can mediate the 5 emotions by affecting the 5 organs, which in turn would treat diseases. It has also been found that there have been no adverse reactions to 5 elements music therapy, so it has been found to be very safe to practice. And originally, the 5 elements music therapy was used in ancient India and Western Egypt to relieve pain and suffering of the ill during and during childbirth. And so just looking now at new studies and different types of benefits that have been found are regulating mood and sleep in patients with depression. It's also found that in combination with conventional therapy, it's been found to be more effective than just conventional therapy on its own. It's also been found to alleviate symptoms of seasonal affective disorder, which specifically a study was done at the Beijing University of Chinese Medicine using this ancient natural music. So this ancient traditional Chinese song called "The High Mountains Flowing River" was specifically used in this study to alleviate and found that it alleviated symptoms of seasonal affective disorder. So we'll just go ahead and play just a few moments from this song here for you. So now we will just have a look at some of the first representations of music therapy and within the 5 elements here, as seen in the Yellow Emperor's Classic of Medicine. So in the musical note section here, we can see the correlation with each of the 5 elements. So the first element being wood, we see the note being jiao, and the musical instrument would relate to the lute, fire being zi and the pipe organ, and earth being gong and a drum. For metal, we see shang and the resonant instrument, and for water, we see yu, and a stringed instrument might correlate with that best. It was also found in the Yellow Emperor's Classic, the quote here that's just saying, heaven has 5 tones as man has 5 organs. So again, they've been able to connect each of these musical tones with one of the organs in the element. And just to break that down even further, just so we can really dive deep into each of the elements here and which music note connected with the organ and the emotion. So for earth, we see, again, gong in Western music note that would relate to the note of si. And we see the emotion as worry, and it's connecting to the spleen. Going into metal, again, with the sheng being the note D, and the emotion for sadness, which would also be affecting the lung. Wood, jiao note E, affecting anger and the organ liver. Fire being Z, the note G, also bringing out or affecting the emotion joy, shock in the heart. And also water to finish. Here we have U and the note A, and the emotion being fear, affecting the kidney. And so overall we have, or I have looked at several studies. A lot of the goals of the study using the 5 elements music therapy, the goal is to bring balance to the yin and yang while regulating qi and blood. And many studies had wonderful benefits of using music therapy. Some include just after 4 weeks, individuals felt significantly less stressed. They had a significant decrease in anxiety and depression. And if you're wondering how is that used in today's practice, so I've discovered one acupuncturist named Lindsay Fauntleroy who has used traditional Chinese medicine's 5 elements music therapy in her practice by creating personalized music playlists based on the 5 elements. And so considering what her patients are going through, whether maybe they have a yin or yang deficiency, she might choose a specialized playlist for them based on that deficiency they might be experiencing. And so with her concepts of music playlists and how the 5 elements music therapy relate to the emotions, we will see how I've also connected that into some songwriting. And at this time, I would like to share 5 short songs that I wrote with my partner, who's accompanying me on the electrical guitar. Each of the songs correspond with each of the 5 elements music notes and emotions. So the lyrics, guitar strumming patterns, and notes were chosen with the intention of evoking emotions based on each element. So for me, as I mentioned before, the goal of songwriting is to help myself or the listener process and or experience emotions that may be stagnant or lacking. Thus, just as in 5 elements music therapy, the music should help to maintain or restore the body's harmony. And so the first song I'd like to share with you would be connected with the fire element. And so keeping in mind the song theme for the fire element would be helping you feel joyful or energized or sexy or loving. And Lindsay Fauntleroy explains the voice might sound like a laughing voice. And as you listen to the song, you might hear some happiness in the sound of my voice as I'm singing, and the emotion here we're hoping to evoke would be joy. And so I'll just play that song for you now. So in that song, you might have also heard an electric guitar and an acoustic guitar, which we also kept in mind that the musical note here for fire would be G. Going into the next song, here we have worry and, the earth element, which the emotion would be worry. And so with this one, the song theme would be building a sense of community, belonging, and the voice, as Lindsay Fauntleroy has mentioned, might sound like singing or soothing. And again, with the emotion being worry, you might just pick up on some of the lyrics that are expressed in this song. Might evoke some worried feelings, but also bringing back to the sense of community and belonging. So we'll go ahead and play this song for you now.
Together we can stand. Together we can fall. Together we can mend all the hurt we feel tomorrow. Don't even worry, babe. We're all here to hold your hand. Don't even worry, babe. Don't even worry.
So you might have picked up on some of the lyrics mentioning don't even worry, and just trying to kind of evoke that sense of community and soothing that emotion of worry. So moving on to the next element here, we have wood. And of course, the emotion we know here is anger. So the song theme here might be explicit, to allow for some of that anger to come out. So we might also want to inspire action or a confidence boost. And Lindsay Fauntleroy mentions the voice might sound like shouting. The note here we have is mi or e, and the organ we're affecting and trying to balance would be liver. So we'll go ahead and play the anger themed song here for you now.
You say you love me, but how can you if you don't see me? You say you need me, but I say I'm leaving.
So you can hear there is anger in the lyrics, but there's also a confidence boost and inspiring action. The lyrics are expressing that I've left, so I don't need your bad energy, and that's supposed to inspire some action and a confidence boost, so kind of managing that anger emotion. And next we'll move on to the water element. So here we'll see that the emotion is fear, and the song theme might be involving a calming, introspective feel to it. So going deep and self-reflecting, and also helping the individual connect to their own power and courage in the face of fear. And so the note here is U or A. So we took that into consideration when adding the electrical guitar in. And the organ that would be affected here would be the kidney. And so we'll go ahead and play the water-themed song for you now. So we hear in the lyrics there, the world has shown me the dark side. So that's the fear, but also recognizing the lyrics were mentioning that they saw hope in their younger self. So they're really digging deep and self-reflecting and kind of bringing back their power and courage in the face of fear. And that voice and guitar might have sounded like groaning. And so we'll get to the last element here, which will be metal. And this one is more of a sad song. So the theme might deal with wonder or greatness or admiration, maybe for an individual or a loss. So someone might be grieving, and we might think that to help someone grieving, we want to make them happy, but actually in this case, using the 5 elements music therapy, we want to use that sadness and evoke that sadness within to help someone, an individual, process that grief. So the voice, as Lindsay Fauntleroy mentions, might sound like sighing or weeping. You can hear the electrical guitar my partner's playing really does have a weeping effect. And the organ that would be affected here is also the lung. So we'll go ahead and play the metal song now.
I didn't know
So hopefully you really felt there the sadness in that those lyrics and also the sound of the guitar. And so that concludes the songs and my presentation. I'll just pop my references up here for my research that I had done. And just to take the time to thank you so much for allowing me to be a part of the 7th World Conference on Integrative Medicine. This has been a wonderful experience. Again, doing research on just the creative and emotional outlet in traditional Chinese medicine's 5 elements music therapy. And I appreciate you allowing me to share this with you and be here with you today. Thank you.
好，谢谢Maggie the great music and the music make me feel the emotional. When I listen to music, I feel real the emotion and the healing experience for the remarkable the music therapy. And thank you, Maggie, for your own music. That's remarkable, and I know this your appreciation for the 7th World Integrative Medicine this platform gave us opportunity to listen your music and your presentation. That's a wonderful experience for me, and thank you very much for this this amazing the amazing emotional and the healing and the therapeutic presentation. And my vision is your success in Chinese medicine, in acupuncture, and in 5-element music therapy to harmonize people's emotion, to harmonize the people's qi, to harmonize the body and the mind. Thank you, Maggie, very much. And looking forward your success and your presentation in the future. Thank you.
哇，真的非常感谢 Maggie， 你刚才的这个展示啊，非常的有疗愈。您的这个非常感谢，你也喜欢我们中国的五行，把这个五行的理解放到了你的音乐疗法当中，结合了美国的乡村音乐，这是一个创造性的发明，而且专门为大会创作这么5首歌，那是很了不起的。我代表我们所有参会的这些医生们感谢你的创作。我们人人都需要音乐，我们人人都需要这个疗愈，我们人人都需要一种情感的交流，音乐就是最好的媒介。而且这个整合医学本身它就包含了快乐健康方式和这个音乐的疗法。非常欢迎您下一届再来参加我们大会。谢谢 Maggie。
傅老师啊，您真感人，说的我都有动情了。
啊，非常好，谢谢 Maggie。所以我们下一位呢，我们要再介绍一位也是加拿大的朋友，我们要看一看这位加拿大的讲员，让我们要欢迎这一位。
傅博，这是科罗拉多的。
哦，这是美国的
一个
讲员，谢谢刘东老师。这个他是叫 Natalie， 叫 Francisco， 是于2008年从弗吉尼亚州拉德福德大学获得生物学学士学位，辅修化学。15年8月 ，Natalie 毕业于CSTCM， 获得了中医传统医学硕士学位。他在 Urban Herb 药房和诊所实习，并后来被聘请为他们的针灸师，同时在丹佛都会区开设了自己的 clinic， 自己的诊所。他是全国的执业医师认证，并目前在科罗拉多中医药大学攻读针灸与中医学博士学位。他在走向医学之路的同时， Natalie 听到了一个呼唤，就是要帮助他人释放他们自己内在潜在的强大的治愈能力。今天他给大家要报告的一位女性专家，也专门研究这个叫中医循证治疗性勃起障碍，这个题目应该是很有吸引力的。那么下面让我们由 Professor Liu 读一下英文的。
Well, thank you, Dr. Jack Fu. Let's welcome Natalie Francisco. She received a bachelor degree of science in biology and a minor in chemistry from the Virginia Rufford University in 2008. In August of 2015, Natalie earned her master's degree of science in Chinese medicine from CSTCM. Interned and then hired at the Urban Herbs, a Chinese herbal pharmacy and clinic. As an acupuncturist, while opening her own clinic in Denver metro area, she is nationally board certified and currently earns her doctorate degree of acupuncture and oriental medicine from Colorado Chinese Medical University. While walking the way of the past, Natalie has a calling to help others to unlock the powerful healing capacities they already hold within themselves. And today, her presentation will be the evidence-informed treatment of the EDS with the Chinese medicine. Let's welcome Natalie.
让我们一起欢迎 Natalie 的精彩演讲。下面由 Natalie 来进行演讲。
Hello, I am Natalie Franciosi coming to you from Colorado, Denver, Colorado in the United States. And I'm here to present to you the evidence-informed treatment of EDS with Chinese medicine. I am a licensed acupuncturist trained in traditional Chinese medicine and Oriental medicine, and currently getting my doctorate in classical Chinese medicine. What is EDS? It is Ehlers-Danlos syndrome, and this is a genetic disorder affecting the connective tissue. And this has underlying abnormalities in the synthesis of metabolism of collagen. The prevalence is approximately 1 in 5,000 births, equally presenting in males and females, but more symptomatically in female-born persons. There are 13 different types of EDS, and they are commonly misdiagnosed as fibromyalgia or chronic fatigue syndrome. And the criteria for their diagnosis is very specific because of its red herrings. They have common presentation of pain. That's the main presentation, so it can mimic a lot of different things. And so the first line defense for it on a Western front is non-steroidal anti-inflammatory medication, steroids, opioids, anti-seizure medications, and then any other secondary anti-anxiety medications that are accompanied with their needs. So it is an autosomal dominant, with particular the hypermobile EDS, which is one of the common diagnoses of Ehlers-Danlos syndrome. And it commonly presents with this hypermobility of the joints and the laxity of the skin. And underneath the microscope, the various subtypes look very differently. And those distinctions are made not only underneath the scope, but within these different presentations and these different abnormalities that are happening in the physiology. So you can see the different subtypes and the names: classical to cardiac, valvular, hypermobile, kyphoscoliotic, and so on and so forth. So we can see these different clinical characteristics and the different types. So the different facial appearances and the bone formation, maybe some defect in the feet or the appendages, excess or hyperextensibility in the joints, or nobular accumulations in the knees or in the thorax region. So what's going on inside the cell? What's the genetic and pathophysiology basis of EDS? So the endoplasmic reticulum is where the protein synthesis occurs. And so when there's dysfunction in that metabolic function, this is who's responsible. There's also the Golgi apparatus, who helps to process and package the protein and lipid molecules that are then exported out of the cell, exiting to further their function elsewhere in the body, the bloodstream, and so on and so forth. But they are not adequately processing their collagen synthesis here. And so what does that look like in a patient's experience? We discussed the chronic pain being the main symptom, but it also is characterized by the joint hypermobility, hyperextensibility of the skin, tissue fragility, easy and prone to bruising, and there's scarification that happens. The musculoskeletal issues such as dysplasia, different bone formation, also hypertonia, hypotonia, a lack of tonicity, congenital or progressive contractures, vascular and viscera complications. And what is connective tissue? So the connective tissue is also known as the fascia network, and this is the housing of the nervous system. And we see many of the dysautonomia because of the dysfunction within the housing of the nervous system. So this tissue originates at the base of the foot and comes up and comes up off the sole of the foot around the heel, and it wraps around the bone, weaving through the muscles and around the muscles, and it weaves all throughout the limbs and within the viscera, within the organs of the abdominal cavity, and through all the joints, intercostals, and then connects at the base of the skull in the occiput. And so this wickerwork and disorder of collagen, it offers such a challenge when there could quite literally be pain anywhere and potentially everywhere for people. This also, the fascia network, is where the meridians overlay. And so we look at where the meridians are mapped, and then we have overlaid that on the map of the fascia networks, and it completely aligns. So it's no wonder that acupuncture is and can be supportive of the fascia networks and disorders of the connective tissue. So let's see, how does Chinese medicine take on this? What is its diagnoses? So the deficiencies of this connective tissue function relates to the deficiencies of the qi, and the qi of many different systems. It could be any of them: the spleen, the kidney, the heart, the lung. It could be the jing, the yin and yang, particularly the liver yin, and potentially a liver qi stagnation and or Shen disturbance. So what is qi and what's its job? So the qi has many duties in the body, and one of the jobs of that the liver has in Chinese medical theory is it is in charge of regulating smooth flow of qi. And when it gets stuck or bound up, it often manifests as pain. And so we call that qi stagnation. Things are stuck. And so we need to move gently, move that energy through so that there's flow, smooth flow. Another job of the qi and its function is the responsibility for holding blood in vessels, which is the heart and fire system, holding bone in the matrix and or brain in the housing. That's the kidney and the water system. Its job is holding muscle tone and strength. And that qi is the spleen and the earth system. Its job of holding sweat in the pores and skin in place. This is the lung and metal system. And then the tendons and ligamental function is predominantly attaching the muscle to the bone. And this is a duty for the liver and the wood system. So we see EDS patients having a vital substance imbalance, and to which one it is dependent on the patient's presentation. And this is how we diagnose and differentiating between which systems are imbalanced. So whether it be a qi imbalance, a blood imbalance, those body fluids, that dryness is a real telltale hallmark. The mind is the Shen, the spirit of the heart connecting to the mind and the heavens. Huge component for those mental illness or mental disorders. And the essence and the jing. So the pre-heaven, the post-heaven, and the kidney essence all going into the jing. So the connective tissue has a relationship to the wood and earth systems. And there are 3 jiaos in our body, or burners, and the upper jiao is connected to the lungs and the heart. The middle jiao is the spleen stomach. Spleen is synonymous with pancreatic function, and the liver, gallbladder, and that's the wood system. And then we have the lower jiao, which is the large intestine, urinary bladder, kidneys, and we're going to zoom back to the middle jiao while we discuss this. The connective tissue has the relationship between these 2 systems because they have a metabolic function. And the wood is the liver, gallbladder, earth is the spleen, stomach, as we said. And if one has more muscle flaccidity, this is signifying an earth imbalance, that lack of tonus and strength and development of tissue. When one has a tendon hypermobility, this will signify a wood imbalance. And whether it is an excess or a deficiency, a deficient pathology will give us information on, okay, is it excess? Is the qi or the blood stagnant? Is there stasis happening? Is something really stuck? Or is there a yin and blood insufficiency? And quite often there could be both. So this leads to complexity. So what is this essence deficiency? What is this substance? So when we see a patient with essence deficiency, there are constituents to take into consideration. So the pre-heaven essence is the genetic material that we get from our parents, from in utero, right? And then we consume the food, which is the post-heaven essence. And this is how we gain, we eat the food, we ingest it, we transform it in our metal jiao, in the spleen stomach. And then it's disseminated into qi and how we gain strength, nutritive value. And then we have the kidney essence, which in men, it is the sperm and the semen. And when women, it is the menses. And these three components equal the Jing essence. And when there's an essence deficiency, patient will present with late closure of the fontanelles, mental fatigue, restlessness, mental delay in development, an uneasiness, potentially loss of hair, early loss of hair. We'll see this, losing teeth, lack of strength in the gums, the insomnia, poor memory, the bone development, not just in the facial structure, but all over. There may be softening or graying, soreness of the back and the knees, and a weakness of sexual activity, potentially low libido, and dullness, dizziness, and potentially in the pulse will feel floating, empty, and rapid, and the tongue may look like red with no coat. And depending on if other things are going on, that's a good nutshell. So how can Chinese medicine help, right? It's beautiful at balancing this yin and yang to harmonize Jing, Qi, and Shen. And in EDS patients, there is a preponderance of yin, and this will be the more lethargic, fatigue, weakness, flaccidity, deformation, and degeneration of the tissue. And if there's a preponderance of yang, there'll be more red, excess heat, stagnation of qi, pain, irritability and anger, and maybe this anxiety and insomnia, this Shen disturbance of energy is rising and then getting stuck. So we can use these treatment principles in my clinical experience. These are the methods that I have utilized with acupuncture for the various diagnoses. So you want to make sure you diagnose appropriately so that then you can treat effectively. And taking a look here, you'll notice many of them have a lot to do with the essence and the kidney energy. Wonderful along the Ren or the Du Mai channels. And if you look in the right column, the liver qi stagnation for excess pathology, gallbladder 34, very nice. For that is the influential point for sinews and tendons. So very, very helpful if people have those issues going on. So my first case study is of a female born in 1983. I treated her about monthly for about 2 years, and chief complaint was body pain, chronically rolling her ankle, low back, knees, dull and achy, presentation that came and went, and worse with pressure and movement. Now, if there is pain that is worse with movement, that signifies to me is a deficiency, because that says they didn't have enough qi and they moved it and it got worse. So they didn't have enough to sufficiently move in the ways that the body ideally will. And it's different than an excess where you move it and it felt so much better, right? Oh, it feels so much better after I get a little flow going. So immediately I'm thinking, okay, we have some deficiency happening. So she's diagnosed with hypermobility EDS type 4, POTS mast cell activation syndrome. She's very cautious while getting body work and has a care team with a chiropractor, kinesiologist, and a physical therapist, is cautious when she gets her body moving and getting body work. She also has chronic low energy and stress and floaters with vision loss and some hearing loss due to a sonic TBI. She wakes throughout the night, has anxiety and palpitations, with those exacerbated when her husband is out of town. She's rearing 2 children, one of which has EDS, and has been diagnosed with IBS and regular menstruation and brain fog, alternating hot and cold, kind of some thermal dysregulation going on. This woman had a very thin and small frame, thin bodies, pale pallor, and the most significant pulse I had been treating her here in the beginning when I had my TCM training. Biggest significance was the large heart pulse and the weak guans, both earth and wood system. And the churs were both thin and thready. So this tells me, okay, there's some kidney deficiency and the middle jiao is weak, with the shen being disturbed. Yes. So I went about nourishing the liver and blood, tendons, and tonifying yang and spleen qi, and I gently moved qi to alleviate pain, opening the yang wei and changmai, doing various unilateral points along the spleen, large intestine, move some qi, support the lung, UB60, and kidney 3, along with do 20 and 24. I also direct moxa. Direct moxa is so lovely. I chose liver 5, gallbladder 34, stomach 36, and I suggested doing a visualization to calm her nervous system, to think about trees by a river, nourishing wood and water. She liked that. The report after the first treatment was that she felt very nice and slept great with noticeably less pain. And I treated her monthly for about 2 years. And the last time I saw her, she came in on her moving week before she left the country. So she was not sleeping well, fatigued, lots of soreness, pain, and was coming off of having COVID 3 weeks ago. No symptoms, but lingering fatigue. So, and currently on her menstrual cycle. So the most significant pulse in classical Chinese medicine, we look at the most significant pulse, the significant change, or the most insignificant. And this day, she had severe metal deficiency. So they looked to opening up the low point on the Ren channel, did Ren 15, to open and help open this thoroughfare, tonified via Tanya treatment, lung 8, and sedated Li5, and then tonified the kidneys as well, as they were weak and deep and thin, and I needed to support that water. So kidney 10 and UB40 with direct moxa for stomach 36, liver 3, and spleen 6. She reported feeling very good after that one too. So my second case study is a non-binary patient born in 1991, female born, and goes by they or he. So the chief complaint is migraines, chronic pain. especially in hips, and refers down legs, whole body nerve pain. Diagnosed EDS, POTS, lupus, gastroparesis, and they have a very low appetite. Also has mental health issues with anxiety, depression, PTSD, autism, and history of suicidality. They have insomnia, chronic nightmares, and challenges sleeping. Had a gender-affirming hysterectomy in 2017 and a top surgery removing the breast tissue in 2023. Mobility challenges, uses an electric wheelchair, and upon first time seeing them, noticed the lack of tonicity and musculature on their legs. Tissue was very pliable and soft upon palpation, pale, sallow complexion, a bit kyphotic in the upper back, and they had dark circles under their eyes. The first treatment in August 2022 noticed very weak in the middle jowl, both earth and wood systems, and big in the Sun position in their heart. So I treated them as a yang body and did the Zhuangzhong for Ren 17 and 6, which is balancing their earth and wood system, 2 needles in 1 point. So opened their Dumai and then gave them Mingmen treatment with Sanjiao 4 and PC6. And their pulses felt much more filled out in both guans and smooth throughout in the Sun and Chur. They reported less pain and no headache. They felt calmer with less anxiety. And their most recent treatment in October 2023, again, pain as their chief complaint, mostly at the base of the skull, and anxiety. And they mentioned that they disassociate from their bodies when they're uncomfortable. So we want to support that Shen to come back into the body. And I gave them a Mingmen treatment and opted to give them some neuroacupuncture, needling both sensory and motor lines, along with the Sanjiao 4 PC6. They reported much less pain in the occiput, head, and back, and felt better, less anxious. And then their pulses were very much less rapid and balanced throughout. So many complementary alternative medicines for EDS. And one of the big things is to convey to your patient that what works for one patient may not work for another. So the grace to work with you in their wellness path. A bunch of nutritional support here with vitamins, supplements, or you can get them through food. I find that the most helpful adjunct therapy is moxibustion, utilizing that beautiful Aya, mugwort, Artemisia vulgaris as a warming therapy. And it puts that yang qi into the body, which they're not producing on their own. They're not producing that from their metabolic function. So we put that in, and it's so soothing. That infrared light to offer that yang qi, and they like it very much, and supports the tensegrity of the connective tissue. So anytime people are getting body work, we want to make sure they're careful not to subluxe, using gentle methods. If they are doing body work and massage, kinesio tape and bracing will help. TENS units, very helpful, low electrical nerve stimulation. Some gentle chiropractic and cannabis mindfulness practices, qigong, very nice. And the biopsychosocial impact of this the genetic components, and they come in with this, and then how do we support them as they go, helping them with their complex physiology, and having them be cautious with their activities, not to injure and sprain and strain, but to make sure that they're getting out and moving and engaging with people, but supporting their psychosocial and physical well-being. So there's a study done in looking at the mental disharmonies that come with EDS, and the most predominant links and multi-diagnoses are autism, bipolar, schizophrenia, depression, and then attention deficit hyperactive disorder, ADHD. And so there is a beautiful opportunity to help the mind strengthen and to really encourage patients to be persistent and patient and stay positive for their mental well-being as well, and to listen as practitioners, for us to listen to them, to their story, and to validate what they can, because most often they have had horror experiences with medical providers that discount their symptoms or experience, and so much mental health really starts with someone listening. And sociological impact, it's really debilitating when you can't physically do things, right? Growing up, you want to act and play and participate, but there's limitation, and continuing to encourage people to engage and relate with their peers so as to prevent isolation. This connection is so vitalizing for your patient's care plan. They have these limitations that disallow them to do things, but reminding that there are embodiment practices that won't harm. And if one is not on too many medications, you must look at what they're taking. They're taking pharmaceuticals, but if they are wanting herbal support, Chinese herbal support, very nice yin supportive formulations here, depending on what their diagnoses are. So must be accurate with this, and depending if it's yang or yin or lung or kidney, we can modify things. And then if there's more of an excess pathology and stagnation, we can give them more gentle moving, alleviation of pain, and you're welcome to combine these. And I would suggest going slow and low dose, and then see how they respond, and have follow up soon after giving them these herbs, and make sure they're taking them many hours after or before their pharmaceuticals. Thank you so much. This has been an honor. Appreciate you. This is my reference page, and take care. Be well.
请刘东老师这个发表点评。
非常感谢。作为一个30多年临床经验的针灸的工作者和教育者，我还头一次系统的学习Natalie 所分享的男性性功能勃起障碍中医治疗的研究报告，非常的值得深入的学习。在这篇这么多的文章这么多的研究报告里，我觉得真是学的太多了，让我也感受到自己学无止境。在以证据为基础的治疗男性性勃起障碍，这个演讲的灵感呢，来自于 Natalie 在众多实践中对于诊断患者的临床的证据的研究，同时对于科学研究报告在美国大量临床报告中关于男性性勃起障碍的研究，以及他的客人们主观的所有的男性客人在自己性勃起障碍里，在70%这么多病人有性勃起障碍，在老年的男性里面，这么大的一个诊断的人群里面，大家的生理、心理和社会环境都受到影响，这是非常难得的一篇研究报告，非常的感谢Natalie 这个的研究，他的研究包括13种类型的男性的性勃起障碍，包括典型型的、经典类似型的、血管瓣型的、血管型的、综合型的、松弛型的，甚至驼背型的勃起障碍、脆性综合症、发育不良、肌肉痉挛、肌肉萎缩，周围疾病。说心里话，我要好好的学习。所以 ，Thank you, Nati, for the great presentation, for the great presentation.
Yes.
西方的这样大量的研究，让我也深深的感到the theory and the important for the erection of disorder is, and we know that acupuncture can be one of the great way, and the Chinese herbal medicine can be one of the great way, and the great evidence to show the acupuncture and the Oriental medicine, the Chinese medicine can treat these 13 types of the erectile disorder. So I'm looking forward the success for Natalie in your clinic for to helping more people for their quality of the life. And thank you very much for Natalie for this great presentation. Thank you.
Yes, the Natalie, like she said, she likes the unlock the powerful healing, the capitalists. That is she already did, because she seriously working on the research, and she seriously the working on the help the people, and she very sensitive find it the certain different type the EDS, and she really introduced about the Chinese medicine and the Chinese treatment, acupuncture treatment and acupressure treatment for treating with EDS. So thank you, Natalie. You are
那
great.
谢谢，那我用中文再点评一下。您这个傅博士用精彩的英语来点评了，非常的清晰。其实啊，他 Natalie 这篇文章里的循证研究呢，就包括中医的循证，包括中医的针灸、艾灸、营养和草药。在他的研究报告里呢，他的循证研究的证据证明，中医的针灸、艾灸、营养和饮食，包括草药的治疗，具有惊人的能力来治疗性勃起障碍。它的原理是通过气的原理，精气神的调理和治疗，使人的身体、心灵和精神赋予了实质。其实写的真好，通过疏通停滞的气，所以我这更能认识到，昨天松涛校长说的气的理论，在松涛校长关于气的研究，关于 AI 的关于 AI 人工智能对于中医的挑战的研究里，对于气的研究是在男性性勃起障碍中也有它的临床的疗效，所以希望松涛博士带领的团队有更多的研究的成果谢谢了。下面把时间交给主持人。
这个我们这个昨天我也听到了 Colorado 的中医药大学的周松涛第一执行长特别介绍了他们学校有一个专门的气的体系的训练，我觉得这个训练和 Natalie 运用的东西很接近。如果 Natalie 能够再向 松涛校长他们学校的这个体系去借鉴、去学习的话，应该还有更多的这个发现。因为其实中国人治疗很多疾病都讲一个气字，包括练气功也可以。像我们练功的人，我们峨眉派有一个秘传的功法，可以让60岁以上的男性可以恢复晨勃。这种只凭练功就可以达到这个技术，在我们实践当中也经常就用一次针灸，让没有那么严重的男性朋友可以迅速的恢复他的性功能。这些都是很多有经验的针灸师屡见不鲜的，有这些案例出现。但是 Natalie 用她细腻的想法把它分得很清楚，又综合运用了我们中医的各种疗法，这是一个很好的创举。So really seriously, the Chinese Qi, it's a seriously help with a different problem. Even you just exercise with the Qigong and Tai Chi, that can help you some improve your body's health. And also, it's if you can drive the Qi, go in your system, use the Qi system, the acupuncture, that is everybody can looking for with Colorado University, the Song Tao Zhou. He introduced yesterday. They have the Qi system, the teaching. That is the first one, the system teaching in the university in American. So that is great. And in the University of East Western Medicine in San Jose, used to we have the Tai Chi, the PhD. And that's the first one in the American too. So that is a really practice Tai Chi and Qigong can help you the Qi. Qi can help you the EDS too. And acupuncture drives the Qi, especially Dr. Bo, the abdominal acupuncture. That's really very good for the EDS. Okay, thank you, Natalie. So let us go to the next one, the speakers. 好，下面呢，我们再邀请下一位的讲员。
录像开了吗？
我们现在呢，就 share 一下 screen。好，这一位讲员呢，他的名字叫做瓦里利 Valerie Lam， 瓦里利兰姆，获得了科罗拉多大学生物学学士学位，并于2019年毕业于科罗拉多中医学院，获得中医学硕士学位。他目前正在科罗拉多中医药大学攻读针灸与中医医学博士学位。瓦里利是科罗拉多职业针灸师、草药师，并获 NCCOM 认证。NCCOM 是我们美国全美的一个针灸学位的认证，在疼痛管理机构工作，并照顾中风和癌症患者。以后他决定追求对更整体和自然的治疗和健康方式的热情。他是提出来的论文要给大家报告的是中医治疗后 COVID 的老误症。好，下面邀请刘东教授讲一下英文。
好，Thank you, Dr. Fu. Let's welcome Valerie Lam. He's required a bachelor degree of the science in the biology from University of Colorado and graduated in 2019 from Colorado School of Traditional Chinese Medicine with a Master of the Science degree in TCM. She now pursue her doctorate degree in acupuncture and oriental medicine from Colorado Chinese Medical University. Valerie is a licensed acupuncture and herbalist in the states of Colorado and board certified by the NCCAOM. After working in the pain management facilities and caring for stroke and cancer patient, she decided to purchase her passion of a more holistic and natural way of healing and wellness. Let's welcome Valerie Lam for the presentation of the efficiency or effect of TCM treatment on post-COVID brain fog syndrome 是中医治疗新冠后遗症的脑雾症一个研究报告。Let's welcome Valerie Lam。
让我们热烈欢迎我们这位非常有热情的针灸师 Valerie Lam。
Hello, my name is Valerie Lam. This presentation is on the efficacy of TCM treatment on post-COVID syndrome, in particular brain fog. Post-COVID syndrome, PCS, is also called long-haul COVID or long COVID and refers to the long-term complications that some people develop after being infected with COVID-19. Signs and symptoms can include systemic, neuropsychiatric, cardiopulmonary, endocrine, and gastrointestinal signs and symptoms. The exact pathophysiology of PCS is still unknown, though data indicates that chances of long COVID manifestation are higher in cases of more severe COVID-19 sickness. Some potential pathophysiological mechanisms of long COVID include virus-specific damage, abnormalities in immunological response, inflammatory damage from acute infection, and microvascular thrombosis. Virus-specific damage could be if the virus attacks certain brain cells directly, blocks blood flow to brain tissue, or triggers the production of immune molecules that could harm brain cells in an inflammation response. So the persistent inflammation caused by viral targeting of neuronal tissue might explain the varied symptoms ranging from changes in temperature, blood pressure, heart rhythm, gastrointestinal motility, energy, and even the muscle aches and deep bone and joint pain. Psychological illnesses are also a risk factor for developing PCS. There is a complex range of biological factors that contribute to the clinical pattern of long COVID, including delayed healing from COVID-19, tissue injury, persistent viral reservoirs, viral interaction with the host microbiome, abnormal coagulation function, imbalanced vagal nerve signaling, autoimmunity, and inflammation triggered by subacute injury in multiple organs. Brain fog or cognitive impairment is one of the more common neurological complications of PCS that can prolong into the chronic stage. There is a significantly higher incidence of PCS in patients who are critically ill with COVID-19, and also higher frequency in women and those with respiratory problems at the onset of infection. Some report these symptoms receding spontaneously, while others report the symptoms persisting over months, even years. So there are over 200 identified post-COVID symptoms. These are just the most common biological symptoms, such as fatigue, general malaise, post-exertion tiredness and weakness, sleep disruption, myalgia, difficulty breathing, arrhythmias, gastrointestinal symptoms, headache, type 2 diabetes, and bone demineralization. Some neuropsychiatric symptoms include brain fog, memory loss, anxiety, depression, attention disorder, dementia, mild cognitive impairment, and post-traumatic stress disorder. Some social factors of PCS can include increased loneliness and decrease of stable social connections due to social distancing and quarantine, an unstable economic situation due to an inability to work, increased general insecurity, increased political and social division, a decrease in social activity due to fatigue, depressive motivational impairment, and fear of reinfection. There can also be increased conflicts with friends and family due to depression and difficulty communicating. Some of the more common treatments for PCS are neurological stimulants like Adderall and Ritalin for fatigue and brain fog, SSRI antidepressants to prevent mood deterioration, and also inhaled albuterol for difficulty breathing. Some of the non-pharmacological treatments for PCS include psychological counseling, physical therapy, progressive exercises, and pulmonary rehabilitation. Conventional therapy has been somewhat helpful, but not significantly effective in the treatment of post-COVID syndrome and long COVID symptoms. Some of the effects of acupuncture on PCS include regulating vagal tone, managing chronic inflammation, managing vasoconstriction, reducing viral replication, and improving adaptive immunity. Improves nitric oxide normalization and improves oxygen absorption. Some of the more common traditional Chinese medicine diagnoses are Shaoyang syndrome, which involve the gallbladder and Sanjiao channels. Cardiopulmonary syndromes can involve heart deficiency and lung deficiency. Sleep disorders can involve heart deficiency and kidney deficiency. Gastrointestinal symptoms can involve spleen deficiency. TCM treatment-wise, some of the more common acupuncture points that are used are pericardium 6, stomach 25 and stomach 36 to help regulate digestion, large intestine 4, 10, and 11 to help with pain and digestion, liver 3 to help move the liver, spleen 6, 9, and 10 to help with spleen deficiency, kidney 3 and 7 to help with kidney deficiency, DU 20 to raise energy, REN 6, 12, and 17 to regulate the upper, middle, and lower burners, lung 1 to help tonify the lungs, urinary bladder 13 and 17 to help with the urinary bladder system, kidneys, and also blood, and GB 39, gallbladder 39. Other acupuncture options are auricular acupuncture, and some of the different points used in auricular acupuncture are the interferon point, the thymus point, the neurogate point, which is often used together with the kidney and sympathetic points, and also point 0. Some of the more common Chinese herbal formulas used are Xiaochai Tang for Shaoyang syndrome. Jin Shui Bao and Shu Mian are used for sleep disorders. Sheng Man Yin, Xiaoyao San, and Xiangsha Liu Junzi Tang are to help with the spleen and liver, and also Lu Zhang Shen. There's also moxibustion to warm the channels, dispel cold, regulate the immune system, and build yang qi. Other treatments can also include laser therapy. In this article, COVID encephalopathy treatment with transcranial near-infrared laser stimulation. Transcranial near-infrared laser stimulation, TNILS, increases the cerebral blood flow and upregulates cytochrome C oxidase in the mitochondria. This basically enhances cognitive function. So the photobiomodulation phenomenon is also called low-level laser therapy, and is a form of light therapy that utilizes light sources like lasers, LEDs, broadband light for pain relief, and also to enhance healing processes via reducing inflammation. LEDs-based light source makes this therapy more accessible, safe, and easy to use in a clinic setting or for help self-treatment at home. In this study of acupuncture and long COVID, acupoint stimulation can improve symptoms of long COVID like cardiovascular, respiratory, neurological, such as olfactory dysfunction, loss of taste and smell, brain fog, fatigue, gastrointestinal, endocrine, other symptoms like mental or sleep disturbances. Acupuncture does not directly affect the pathogen, but plays a crucial role in restoring health and balance to significantly improve the quality of life of patients. These studies demonstrate that acupuncture can be effective against long COVID, but there's limited evidence at present due to a lack of systemic reviews and due to the small sample sizes. So large sample size, high quality randomized controlled trials are needed to provide clinical evidence of the efficacy of acupuncture to treat PCS. In this article, comparison of QEEG findings before and after onset of post-COVID-19 brain fog symptoms. QEEG stands for quantitative electroencephalography, which is essentially brain mapping, and it measures specific pattern of changes in electrical brain activity. In this study, there were a total of 145 participants. So 125 participants did not have COVID. 20 volunteers who did have COVID-19 and also reported symptoms of COVID fog, such as problems with memory, spatial orientation, and concentration, were recruited. So there were 10 men and 10 women. In the 20 COVID fog participants, QEEG recordings showed a clear change in activity patterns after onset of COVID-19 compared to baseline recordings. Essentially, there were changes in the different types of brain waves in the right hemisphere as compared to the left hemisphere. And also a reduction in SMR values. SMR values are the sensory motor rhythm, which is the control of electrical brain activity. So the results of this study indicated that COVID brain fog did change brain activity in patients with PCS. In this case study, acupuncture in multidisciplinary treatment for post-COVID-19 syndrome, it was an observational study of a 46-year-old male with long COVID syndrome. The chief complaints were chest pain on inhalation and dyspnea that was constant and needed to take breaks during walks. Intermittent stinging pain in the second and fifth finger cuticles, joint pain that had worsened significantly after infection, fronto-occipital headaches several times a week. Headaches were quite infrequent for him prior to infection, and also severe fatigue and sensation of heaviness in body. So some of the primary TCM syndromes for this patient were lung qi and yin deficiency, qi and blood stagnation, spleen qi deficiency, and dampness. Treatment points that were used most often on him were yin tang, spleen 9, spleen 10, lung 7, kidney 6, large intestine 4, liver 3, stomach 36, spleen 6, liver 8, Sanjiao 5, gallbladder 41, heart 7. The patient did report improvement after 6 treatments, which suggests that acupuncture can be effective for treating post-COVID syndrome, but more research is needed to better understand the pathophysiology of PCS and establish Chinese medicine as an effective treatment method. So this is just listing the 5 elements of TCM and the corresponding organs, emotions, taste, and also the types of spirit that it houses. So for fire, the corresponding organs are heart and small intestine, and also pericardium and Sanjiao. Its emotion is overjoy, its taste is bitter, and it houses Shen. Earth is spleen and stomach. Its emotion is overthinking and worry. Its taste is sweet. It houses Yi. Metal, lung and large intestine. Its emotion is grief and sadness. Its taste is acrid. Its spirit is Po. Water is kidney and urinary bladder. Its emotion is fear. Its taste is salty. It houses Zhi. For wood, liver and gallbladder. Its emotion is anger and depression. Its taste is sour. Its spirit is Hun. In the many cases of post-COVID syndrome, the more commonly affected channels are the heart, the lung, the spleen, and the kidney. Some other TCM diagnoses also include qi and blood stagnation. In classical Chinese medicine, the patterns would translate to an imbalance in the 5 elements. So heart corresponds to fire, lung to metal, spleen to earth, kidney to water. Liver to wood also factors into this imbalance, even though current TCM diagnoses do not generally indicate liver stagnation or liver deficiency. The gallbladder is part of wood, and Xiaoyang syndrome does include the gallbladder. Wood generates fire and controls earth. Both of these elements could lead to brain fog if imbalanced, since fire controls Shen and earth transforms damp. Diminished Shen and damp would result in sleep disturbances and cognitive impairment, as well as fatigue. As you can see in the picture on the side, the generating cycle, wood generates fire, fire generates earth, earth generates metal, metal generates water, and water generates wood. In the controlling cycle, water controls fire, fire controls metal, metal controls wood, wood controls earth, and earth controls water. So according to many studies, the main pathologies appear to lean more towards deficiencies like heart, lung, spleen, and kidney deficiency. So in CCM terms, this would be as if earth fails to generate metal and metal fails to generate water, which could lead to an imbalance in fire and water and cause sleep disturbances and respiratory symptoms as metal and fire are not balanced. Fire could fail to generate earth, which could cause GI symptoms with a deficiency in earth, and a deficiency in metal and water could still result in similar imbalances and symptoms of sleep disturbances and respiratory issues. Brain fog in TCM is a symptom of spleen deficiency. In CCM, it could be caused by other imbalances. Deficient earth results in dampness, which can flare up to miss the mind. This matches with TCM. Also, if the imbalance in the earth element can lead to imbalance in water, water houses the if water were out of balance, could be affected and could lead to more brain fog, difficulty focusing, and other cognitive impairments. A fire imbalance could affect wood and earth to cause brain fog and mood changes. I have a couple of case studies of my own. Case study number 1 is a 75-year-old female. Her chief complaints were leg pain and edema in the ankles, loss of taste and smell since COVID. It'd been almost 3 years since her first infection. Brain fog. She mentioned memory issues before, but complained of brain fog after her second COVID-19 infection. She also complained of GI issues, insomnia, which she also had before the infection, but worsened after COVID-19, and also cold and heat sensitive. The treatments are based on pulse presentation on day of treatment. So in her first treatment, it was Mingmen fire deficient. This is the pericardium and Sanjiao channels, so tonify Mingmen fire. In the second treatment, she was water insufficient, so I tonified water. She did mention that after the last treatment, her leg pain had improved. Her third treatment, earth excess, in this case refers to a slippery spleen pulse, which indicates dampness. So to sedate earth, which is the spleen and stomach, her taste and smell had started to improve here. Her fourth treatment, also water insufficient, tonified water again. Her leg edema did seem to be getting better. Her fifth treatment was 2 weeks after the fourth treatment. She'd had to skip a week due to her second COVID infection. And this week after the COVID infection, she was still water insufficient. So continued to tonify water. Her taste and smell were gone again. And she did feel quite congested. In the sixth treatment, her pulses presented wood insufficient. So tonify liver and gallbladder. She mentioned after the treatment, her chest tightness and coughing had started to get better. her brain fog did feel like it was getting worse. 7th treatment, Mingmen fire is insufficient, tonify Mingmen fire. Patient is still receiving treatment, but not necessarily consistently, so her symptoms can improve and then results stagnate again when the patient takes a break. In my second case study, patient is a 22-year-old female. Her chief complaints, these were symptoms that occurred after a possible COVID-19 infection. She'd gotten all sorts of blood tests afterwards, and they had all come back inconclusive. So myalgia, whole body aches that were constant, pain levels that might fluctuate through the day, but were at a fairly average 7 out of 10. Pain was worse at night. She also complained of fatigue and low energy, sleeping a lot, but still very tired, also doing minimal exercise and limited activities due to the low energy. Other symptoms she complained about were brain fog, anxiety, depression, and digestive issues. Her initial tongue presentation was swollen, pink, slightly greasy coat in the middle jowl area. And initial pulse presentation was overall deep and constrained. Both guan and shi positions were deficient. Right sum position was slightly excess in comparison. All treatments were based on pulse presentation on day of treatment, and again, time between treatments did vary. Her first treatment was earth and wood insufficient, so tonify earth and wood. I did also prescribe Xiangsha Liu Junzi Tang for her to tonify spleen and drain damp. In her second treatment was earth excess, so sedate earth, again, drain damp. Third treatment was water insufficient, so tonify water. She mentioned her energy was improving and stabilizing. In the fourth treatment, it was water and Mingmen fire insufficient, so tonified water and Mingmen fire. In the fifth treatment, Mingmen fire was insufficient, tonified Mingmen fire. In this treatment, she mentioned that her doctor had prescribed a gabapentin. The gabapentin in combination with the acupuncture had improved the pain, but her fatigue had worsened. In the sixth treatment, her pulses presented fire excess. So sedate fire, the heart and the small intestine channels. She did have pain relief for almost 2 weeks since the previous treatment, but on this day of treatment, her pain was back again. On the seventh treatment, again, fire excess, sedate fire, harmonized earth and wood, so harmonized spleen and liver. She complained of digestive issues, and her pain was at a 50% since the last treatment. In the eighth treatment, she was water insufficient, so tonify water, the kidney and urinary bladder channels. Her pain was okay, but she did still have some digestive issues and stomach pains. In the ninth treatment, water and wood insufficient, tonify water and wood. Her digestive issues were beginning to improve. Body aches were better. She was having PMS symptoms on this day. The ninth treatment was the last time I saw this patient, but the last few visits show marked improvement. The conclusion of this presentation is that COVID brain fog does affect brain activity, and while not physically debilitating, can still be devastating to a patient's quality of life. Acupuncture is effective in improving post-COVID syndrome to shorten recovery time, improve symptoms, modulate inflammation, improve oxygen intake and circulation, regulate blood pressure to help positively influence disease outcome. So even though studies show that acupuncture and herbs can help improve PCS and relieve symptoms like brain fog, more research is needed to obtain more significant supporting evidence, like large sample size, high quality randomized control studies. And for anyone who is interested, this is my list of references. Thank you.
哦，谢谢 Valerie 的精彩的演讲。新冠后遗症的综合症对于人口和健康的经济产生了巨大的影响。 所以听到这个中医治疗脑雾症、新冠后的脑雾症的报告呢，让我心情呢也很沉重。我也在学校讲课，学生的作文里头、学生的报告里头，焦虑的程度、脑雾症的程度都在谈论。尽管新冠已经正式过去1年了，但是新冠感染后的一系列的症状，因为它的病症各种各样，病理生理机制还不清楚，包括疫苗的机制还不清楚，这样使新冠后遗症的治疗变得缓慢和困难。长期新冠症状的表现呢，多个脏器器官的障碍。在Valerie Lam 的演讲里呢，它包括了疲劳、怠倦、咳嗽、关节痛、深的骨头痛、自身免疫疾病、焦虑、抑郁、记忆丧失、脑雾，特别是脑雾，脑像一段雾来一样，像慢性疲劳和肌肉疼痛，影响着人的生活的健康，影响着每个人的日常的生理、心理和社交的功能和认知的障碍，极大的破坏了人的健康的行为。随着时间的增加，在美国最新的研究，脑雾可以表现为混乱、短暂的记忆丧失、头晕，甚至无法注意力完成。这种注意力不集中、逻辑推理的受损和决策，是新冠后遗症里这种独特的，而且机理是不清晰的。所以呢，中医治疗包括针灸、气功、草药，在 Valerie 这篇的论文讲演里呢，给我们提出了挑战。实际上，给我们每一个中医人、每一个中医整合医学工作者都提出了挑战：如何应对后新冠或者新冠综合症、新冠后遗症的治疗。在这篇文章里的脑雾特别强调了给我们人们的挑战。在这篇的循证研究报告里呢，也给大家提出了希望，就是中医针灸和气功、食疗，特别是气针，对于气的，刚才又回到了松涛校长刚才昨天提出的一个概念，希望 the Qi acupuncture can treat the fatigue, cough, or joint pain, or deep bone pain, or brain fogs. Thank you, Valerie Lam. This is a great presentation, and we make us think and make our heart heavy. But we also see the hope. And thank you, you gave this vision. Thank you, Valerie, gave us a vision for looking for the hope for TCM treatment on post-COVID brain fog syndromes. Thank you very much.
Thank
下面
you.
有请傅博士来评论吧。
Thank you, Valerie Lane. You did everyone should research about the problem, because right now after the COVID, a lot of symptoms we call the lung symptoms with the COVID, and you talk about the brain foggy. That is it's a number first 3 of the side effect with the COVID. That is really it's a difficult problem, but it is, we already find it a lot of the acupuncturists, we find it a different way to fix this. Example, I know in the England, Dr. Wang already long time ago talk about from the Bai Hui, from the traditional the Si Shen Cong, from the in front the Ben Shen, and from the side they can treat with foggy. And I saw you this presentation. It's very interesting. You have your experience. You still talk about the qi. You talk about the acupuncture. You talk about the Chinese herb. So that is the right direction. Let us together find the better way to help with the brain foggy. For ILO, it's the most simple way, can make you a little clear. This coming from the Dr. Bo from China. 2 hands hold your ear, very hard, press 1, 2, 3. If you made a little painful, regular any type the headache, any type the foggy, they can a little bit more clear. And another simple way for ILO, it's a 5 finger put together, just tap your top head. Tap your top head. That's always can make you a little more clear. And also you can massage both sides, this big muscle, then that can make your head the circulation different. And the traditional Chinese, we see the comb your hair. Just press on your head, comb your hair. That's always help some. That's a 3 simple way. I like the adding here. Thank you, the Dr. Van name. Thank you.
哎呀，谢谢傅博士，这个是个挑战。现在越来越多的人，所以啊，您有前瞻性。去年去年的大会是新冠后遗症大会，上今年也应该有这个主题。
其实我们有考虑过这个主题，只是因为今年呢各个国家都放开了，但是呢我们这个长新冠其实还是存在的。而且这个新冠的后遗症也很多，我们去年就讨论了很多，我们以后还会继续关注这个话题。Thank you，谢谢刘教授。Okay, so let us welcome the speakers。让我们欢迎下一位演讲者。我来分享一下他的 PPT。